Comfort devices. Introduction. Comfort is a sense of mental and physical well-being. Physical comfort gets affected due to a dirty and wet bed and lack of body alignment. High temperature and humidity, poor ventilation, too much noise, unpleasant odors and glaring lighting make the patient uncomfortable. To promote comfort for the patients, certain mechanical devices can be used. Definition. Comfort is a state of freedom from pain and discomfort, tension and anxiety. Comfort is defined as the contented enjoyment in physical or mental well-being, freedom from pain or trouble. Discomfort is defined as want of comfort or ease due to pain or annoyance. Comfort devices are the mechanical devices to promote comfort to the patient. Comfort devices are invented articles which would add to the comfort of the patient when used in the appropriate manner, by relieving the discomfort and helping to maintain correct posture. Purpose of comfort devices. 1. To relieve discomfort. 2. To immobilize body part. 3. To relieve pressure on parts of body. 4. To prevent falls and accidents. Principles of comfort. Definite periods of sleep are an essential component of the circadian rhythm in human being. Adequate amounts of sleep are needed for optimal physical and psychosocial functioning of the individual. Individual needs for sleep vary with age, growth patterns, health status and individual differences. Lack of sufficient sleep impairs a person's physical functioning, his mental alertness and his social relationship. Individual habits vary with regard to bedtime rituals. Sleep pattern may be disturbed by changes in person's normal daily living patterns, by social and emotional problems, by physical problems, and by minor irritation or discomforts. Sleeps at terms are almost invariably disturbed by illness. Factors influencing comfort. Pain. Restriction of movements due to weakness. Wrinkled, soiled and wet sheets. Delayed or inadequate attention to meet the personal needs. Lack of exercise. Temperature extremes. Too bright lights and glares. Fear and anxiety due to illness. Insecurity feeling. Lack of sleep. Uncomfortable position. Indigestion and irregular bowel movements. Types of comfort. Relief, the state of having a specific comfort need met. Ease, the state of calm or contentment. Transcendence, the state in which one can rise above problems of pain. Context in which comfort occurs. Physical, pertaining to bodily sensations, homeostatic mechanisms, immune function, etc. Psychospiritual, pertaining to internal awareness of self, including esteem, identity, sexuality, meaning in one's life, and one's understood relationship to a higher order or being. Environmental, pertaining to the external background of human experience, temperature, light, sound, odor, color, furniture, landscape, etc. Sociocultural, pertaining to interpersonal, family, and societal relationships, finances, teaching, healthcare personnel, etc. Also to family traditions, rituals, and religious practices. Types of comfort devices. Pillows. Pillows are used to give comfortable position to the patient. These are most commonly used to support various body parts. Purpose. To maintain proper body alignment. To support body part in good alignment. Help to reduce pressure. It can be folded, rolled or tucked firmly against the body to maintain position. It is used to support head, neck, arms, legs and part of the back, adds to the physical comfort. Backrest. Backrest is a mechanical device which provides a suitable support and rest for the back of the patient in sitting position. Purpose. Times to support back. Times to facilitate easy breathing. Times it is given especially for heart patients and asthma patients. Times used in post-operative period. Hand thigh rolls. Hand rolls are made of cloth that rolled into a cylinder, about 4 to 5 inches long and 2 to 3 inches in diameter and stuffed firmly. Purpose. These used to keep the fingers from being held in a tight fist, leading to flexion contracture in patients who are unable to move hands due to paralysis, injury or disease. Thigh rolls are made by folding a sheet to the desired length of 2 to 3 feet and then rolled into a tight cylinder. Thigh rolls are used to support hips and thighs, preventing them from outward rotation and keeping the feet in good alignment in case of paralysis, fracture of femur or hip surgery. Foot rests. Foot rests are the mechanical device used to give rest to feet. Sandbags or footboard may be substituted. Purpose. Times it helps to maintain the normal position of feet. Times it is used for the comfort. Times to prevent foot drop. Sandbags. Sandbags are canvas, rubber or plastic bags filled with sand and are 1, 5 and 10 pounds in weight. Sandbags are used to immobilize a part. Purpose. Times to relieve discomfort. Times used to support the body part. Times used to immobilize the body part. Times used to support as in fractures bones. Times to prevent foot drop or wrist drop. Air and water mattresses. Air and water mattresses are used for very thin or obese patients and for those who are prone to get pressure sores. The principles is that pressure exerted by the body will be distributed equally in all directions. Air and water mattresses are plastic mattresses with 2 sets of chambers. To use them, place the mattress on the bed and fill air or water in the compartment. Cover the mattress with light bottom clothes. Purpose. Times to improve circulation. Times to provide comfort. Times to prevent pressure sores. Times used in very thin or very obese patients. Times used in chronic bedridden patients. Caution. Avoid punctures in the mattress with needles, pins or other sharp objects. Rings. Air rings are made of rubber. The air rings is inflated about half full, tested for leakage, covered and placed under the patient's hip in such a way that the value is on side and not in contact with body. Cotton rings are made wrapped with bandage. These are placed under the bony prominences such as heels and fastened in place if necessary. Purpose. Times used to lift the hip from bed to prevent bed sores. Times it helps to prevent direct pressure on bony prominence. Times it improves the circulation. Bed cradles. Bed cradles vary widely in size and in material. Bed cradles are of wooden, metal or electronic. The bed cradles support and take off the weight of the bedding. Bed cradle are semicircular in shape, made of wood or metal or entirely made of metal tubing or slats. Purpose. Used to prevent the top cloth is coming in contact with the patients, especially in burns patients. To apply heat in case of drying plaster casts. Electronic bed cradles are used to supply the desired warmth to the case of shock. Bed blocks. Bed blocks are made up of wood size. It may be high or low. These are placed under the foot of bed for various reasons. Purpose. Times to prevent shock. Times to arrest hemorrhage. Times to retain enema. Times after spinal anesthesia. Times after tonsillectomy. Times to provide traction. Times to position in postural drainage. Air cushion. Air cushions are round in shape and made up of rubber. These can be inflated with air. These are used to take off the weight of the body. Air cushion should not be applied directly in contact with skin. They should have a cover. Purpose. To relieve pressure on certain parts of the body. It provides relaxation as it yields to shift of body weight and it relieves pressure on certain parts of the body. Cardiac table. A table is in the hospital for patients' use during hospitalization. It is used to maximize safety of both patients and staff. Improve patient's surrounding by modifying the current cardiac table to one that can be kept and folded. Bed table placed in front with a pillow on it. Patient can lean forward and take rest. Table without pillow is used for writing and meals. Used for patients with cardiac conditions and asthma. Position should be changed to relieve fatigue. Purpose. Times patient can rest over the table with the help of pillow. times helps to take meals and in writing. Footboard. Device that is placed towards the foot of patient's bed to serve as support for his feet. Usually made up of wood, plastic, heavy canvas. Purposes: to support patient's feet, to prevent foot drop. Trochanter rolls. A cotton bath blanket sheet is folded lengthwise to width, extending from greater trochanter of femur to lower border of popliteal space. Purposes: prevent external rotation of legs when patient is in supine position. Side rails. Side rails are the bars positioned along the sides of the length of the bed. Purposes: ensure patient's safety and are useful for increasing mobility. Provide assistance in rolling from side to side or sitting up in bed. Wedge abductor pillow. It is a triangular shaped pillow made of heavy foam. Purposes: used to maintain legs in abduction following total hip replacement surgery. Knee rest. This is a device placed under the knees to provide comfort. Purposes: this gives relaxation and thus relieves pain on tendons beneath the knees. Fracture board. Fracture board is a support that is placed under patient's mattress to give added rigidity to the mattress. Usually made of wood canvas and is constructed to fit the standard hospital bed. Bradford frame. It is a canvas stretcher-like device that is supported by blocks on the foundation of bed. It used to immobilize patients who have injured spines. Canvas is divided into 3 parts so that small center portion can be removed to insert a bedpan. Balkan frame. Balkan frame is made of wood or metal that extends lengthwise above the bed and is supported at either ends by a pole. Trapeze may be attached to the frame just above patient's head as an aid to the patient in lifting himself up in bed. Fracture board. Trapeze bar. An overhead trapeze is a triangle-shaped metal bar. It hangs from a metal frame, which is attached to the headboard and footboard of the bed. A triangular metal apparatus above a bed, used to help the patient move and support weight during transfer or position change. Trapeze bar is suspended from an overhead frame that extends from the foot to head of bed. Patient can grasp the bar to raise the trunk of the bed surface or to move up in bed. Role of nurse in comfort measures. Nurse identify comfort needs of patients and family members. Nurses design interventions to meet identified needs. Intervening variables are considered when designing interventions. When interventions are delivered in a caring manner and are effective, and when enhanced comfort is attained, interventions are called comfort measures. Patients and nurse agree on desirable and realistic health-seeking behaviors. If enhanced comfort is achieved, patients and family members are more likely to engage in health-seeking behaviors. These further enhance comfort. When patients and family members are given comfort care and engage in health-seeking behaviors, they are more satisfied with health care and have better health-related outcomes. When patients, families, and nurses are satisfied with health care in an institution, public acknowledgement about that institution's contributions to health care will help the institution remain viable and flourish.